I wrecked on January 13th. I had spinal surgery. I fractured C4, 5, and 6 and punctured my spinal cord.
The doctor, he was pretty blunt, and he told us, she may never walk again. She could be on a ventilator. He just, throw that out there, and, we were just beside ourselves.
Haley was hospitalized in Huntington, West Virginia after her car accident. She lives in Salyersville, but chose to come to Cardinal Hill Rehabilitation Hospital in Lexington for therapy.
I wanted nothing but the best, and I had heard so many good things about Cardinal Hill. It was a relief knowing we were coming here. She couldn't even stand. She couldn't do nothing. Not when we first got here, she couldn't do nothing. I think the only thing she done was maybe lift her left little small finger pinky, but that was it.
As are all patients, Haley's condition and needs were evaluated that first day so that a therapy plan could be designed for her situation.
The first day I got here, they was trying to help me stand up. They put me on a machine that strapped me in and assisted me to stand. And I think it was the next day they started with me walking.
The first day, I really didn't know if I was allowed to go into the gym. There was like 3 or 4 of the family members standing and, watching through the windows, and they invited us in. It was very friendly and nice.
She was allowed to stay with me the whole time and go to therapy with me, and it was extra support.
Haley's inpatient stay ended, but she continued to receive therapy at Cardinal Hill as an outpatient.
The first day in outpatient, she walked in here with a cane, but her left arm, she really couldn't do anything with her, none of her left arm, her wrist, her hand, anything.
We always ask the patient, what are the goals you want to achieve? What's important to you? So we do try to work that in somehow into their therapy, because it is their therapy and it's client driven.
I want my arm to be back where it used to be, and it's well on its way there.
A continuity of care is created when a patient returns for outpatient therapy after an inpatient stay that benefits the patient, the family, and the outpatient therapist.
Yeah, because it's a lot of the same environment, and everyone's very helpful here.
When a patient does their inpatient stay here, then I have the luxury of going to those therapists when they're referred to outpatient and asking, what did you work on while you were inpatient? What did you see were weaknesses? A lot of our therapy is concentrated on her left upper extremity, which involves her scapula or her shoulder blade and the arm and her hand. She has weak muscles that tend to rotate and turn the scapula. So we were really isolating and working on her shoulder blade moving in the planes that it's actually supposed to.
I can raise my arm up. I wasn't able to raise my arm at all when I started outpatient. I can now grasp things and pick things up with my left hand. My balance has also improved tremendously since I've been doing outpatient.
By the time they come to us in outpatient, they are ready for us to really hone in on their weaknesses and to help them be able to incorporate all the techniques that they're going to need to continue to get stronger and to be more independent.
I would like to thank the staff of Cardinal Hill, inpatient, outpatient. Everything they've been wonderful, absolutely wonderful.
I've reached all my goals plus more while I've been here.